Thanks so much, Jimmy, for that sort of insider's view of the role that the US plays in the global response to microbial threats, which is, as you say, is a very, very important role, but also for highlighting some of the challenges and how that does have its ebbs and flows as well. So SUZET, to the local level, is that an easier place to sustain and integrate these efforts, or do you have similar challenges?
Well, I would tell you it is certainly a place where a lot of these things need to get implemented. So good morning, everyone. Thank you so much for being here today. It's, of course, my great honor to be here. So thank you to CC and KG and the organizing committee for the invitation. So I was asked to discuss the local level, but from the perspective of three main questions. The first being, with so many competing priorities and limited resources at the state and local level, how can the business case be made to sustainably invest in outbreak preparedness rather than just response? And my first statement toward that question is that I would fully endorse the concept that Julie talked about, and that is the right brain situation. Complacence is real. And what I see at the local level is really, you know, when you talk about the science and the policy and the operational guidance, the local level is really where the rubber meets the road. But our challenge in public health is that, number one, historically, we've never done a good job of telling our stories and telling the value of the work that we do. And so once the outbreak has passed, it is very, very easy to forget. Secondly, I would say that pre-outbreak, the challenge at the local level is that, you know, there are no bombs being detonated, people are not falling ill in the street, and there's nothing tangible that we can direct stakeholders to or our leadership to with regards to these outbreaks. And so that means we need to identify a more compelling way of helping our stakeholders and our leadership understand the challenges with outbreaks, the significance of the impact of those outbreaks, and illustrate that for them in terms that they can relate to and that they understand. As I was thinking about this yesterday, I was looking around the room at all of the brain power sitting in this room, and I thought to myself, this is fantastic, but we need to see workshops like this occurring at the state and local level, where we bring together healthcare officials, government officials, and business leaders in forums like this, and utilize examples from real emergencies and real outbreak situations so that those stories can be told, the information can be relayed to those leaders and stakeholders, and the messages can be delivered about the importance of outbreak preparedness. And then finally, I would add that champions from industry and philanthropy are also very helpful, especially where there is additional financial support available. The second question that I was asked to explore is what kinds of strategies and leadership are needed to gain political and financial support from high-level stakeholders at the state and local level, and then to what extent is buy-in and coordination needed from the federal government. And I think the overarching strategy there is that we need to help educate local leaders and stakeholders, again, so that they understand the impacts of these outbreaks. For example, with state and local politicians and elected officials, things like the economic health of their jurisdiction, disruptions in their educational system, and civil unrest are all things that in cities like mine cause people to lose elections. And so helping them understand how outbreaks can actually impact their abilities to govern, as well as how investment and preparedness can protect against those challenges, will go a long way. Similarly, helping business leaders understand how pandemics can impact their bottom lines can also have the same effect. For example, when we think about the 1918 pandemic and even others where severe worker absenteeism is an issue or was an issue. The fact that severe absenteeism can be one of the results or one of the impacts of a severe pandemic, but helping business leaders acquire the knowledge and understanding that their investment in systems and technology that can promote strategies that will minimize that worker absenteeism will help them, I think, understand, once again, the importance of investments in preparedness. And as a local official, first of all, I would tell you that education is key. And the best way that I can illustrate what I'm talking about is to give you real-life examples from my work. So during the Ebola outbreak, my office conducted an educational workshop for our local leaders. And in the course of that workshop, I had two high-level leaders. One, the medical examiner at the time, who could not find the time in his schedule to give me a list of equipment that he could use to augment his office and his office's response. As the preparedness director, I had access to federal funding and had offered to purchase personal protective equipment and other resources for his office. But he didn't have the time to let me know what type of equipment he needed. But yet, at the thought of having a patient under investigation, his response in that educational session was, well, if something tragic happens, don't send that body to my office. Well, where else would we send the body? Or the police officer who asked me if he encountered someone who was suspected to have Ebola, could he shoot to kill? Because he saw that as a possible sort of offense to his own health and safety. So again, at the local level, and I'm not saying that that's the situation everywhere, but the education is key. And then finally, the third question, how can local communities help contribute to ending the cycle of panic and neglect? I think we have to equip people in communities. And I'm not talking about elected officials and politicians and business leaders. I'm talking about the people who live and work in these communities. We have to also equip them with information and knowledge, because information and knowledge are empowering and they enable people to act. So many communities, especially in areas where we find significant numbers of underrepresented groups or more vulnerable groups, continue to have issues with trust in the government, and which is often associated with secrecy and the withholding of information. So in order to move beyond this level of mistrust and to enable people to act and move them to compliance with things like vaccination campaigns, we have to do a better job of including the community in our preparedness efforts. Community engagement is a powerful tool, and not only can help us in that panic and chaos, but can also help officials gain better understandings and significant insights into some of the more unique vulnerabilities within specific communities. And then finally, I would add that community health workers, faith-based organizations, and community-based organizations are all trusted agents in the community and can help those communities begin to understand what it means to engage in preparedness efforts for outbreaks, which I believe will aid us significantly in decreasing panic and neglect around this issue. Thank you.
Thanks, Suzette. And I think a lot of things in common with the previous speakers, but particularly showing the importance of participation and efforts and reaching out to communities. I mean, when we look at pandemics, we often forget that there are great social inequities in the impacts of pandemics. I mean, for example, in 1918 in New Zealand, the mortality rate among Indigenous Maori was 8 times the impact in the general population, and that those groups often do have mistrust and negative experiences with government institutions, and need to think about that and sort of sustaining those efforts. I also, sure.
If I can just take 1 second to add one thing, I neglected to raise the issue about funding and federal government investment. And I just want to make sure that I say that that is critical. Julie mentioned the fact that funding is decreasing and in some cases completely obliterated. And I think at the local level, when we don't see sustained federal level investments in preparedness for outbreaks, it is very difficult to make the case that local and state officials should be making those investments as well.